Hi, welcome to the best home treatment guide for skin calluses and corns. I'm going to be going over quickly how to make sure you actually have a callus or a corn, what's causing them, home prevention tips, and home treatment tips. So let's get started. So, you have corns on your feet, they're painful, they look like this, they're on your toes, they're not really in pressure areas, or they could be diffusely across the bottom of your foot, and we want to get rid of them. So, first step, how do you know you really have a corn or a callus? Or can it be something else? Well, the image on top looks like a callus, but really it's a wart. The way you can tell is at the bottom, with the callus, the skin lines go through the callus. As you can see, they're going through, whereas with the wart, they're going around it. So it's like something grew in between the skin lines and spread them out. And also, the second easy way, is to see these little black spots. See how the wart on top has little black spots and the callus at the bottom does not. These black spots are thrombosed capillaries, so they're just blood vessels that sealed off and it's dry blood. So that's how you know. And it is possible to have a wart like this that's thin for many years, so just make sure it's not a wart. And the difference between a corn and a callus are calluses are usually diffuse, like thickened skin, whereas a corn is circular, and in the middle, if you were to cut this away with a scalpel, a little ball on the inside. Now, this isn't to say they could be very similar. It's not a discrete line in between the two. You could have a callus with a corn in the middle. In fact, some of the worst cases do. So, the good news is you treat them both very similarly. So, what causes corns and calluses? High arched feet, flat feet that cause hammer toes, both of those can cause hammer toes, and pressure deformities. So what happens, especially with the hammer toe, is the foot doesn't absorb shock as well. You see there's a pressure area at the bottom, the top runs against the shoe, even the end of the toe rubs against abnormally. In fact, because there's not enough room in the shoe, could be why you're getting it. Poorly stitched shoes, wearing loose shoes or sandals or high heels that increase pressure or friction in the forefoot. Now also, these aren't the only reasons there could be many, like diabetes, leading to weaker skin, rheumatoid arthritis, weight, poor mechanics. If you had an injury before, you hurt your knee, your back hurts, you walk awkwardly, you don't walk the way you were intended to, and you put pressure in different areas of your body. So, what can you do to prevent calluses? Number one, you should go to any podiatrist or athletic store and use this. It's called a Brannock device. Make sure you're wearing the right shoe. Get the right foot length, foot arch length, and the foot width. Most people, when they're 16, 17, 18, they find out their shoe size, say like a size 9, and they keep wearing that. But that's not true. As you start to progress, the more weight's been put on your foot, your feet start to increase in size. And also make sure you measure your feet at the end of the day, because as you walk around, your feet get a little bit more swollen. They could grow by half a size or more for some people. So use a Brannock device and make sure you measure your foot at the end of the day. If you're buying shoes, make sure it's not a flimsy, flat-soled shoe. Now, it's okay to wear those, but if you have calluses, I'm just telling you what's recommended for calluses. Get a shoe that only really bends at the front. Make sure you have a rigid heel cup at the back, and you can't just grab it and flimsily twist it. I know this is for a lot of ladies especially. I know my wife you can grab her shoe and twist it around, and there's a lot of pressure areas there that can lead to a lot of pain. Now, another thing you can do is in any CVS, any Walgreens, wherever you go, corner store, there's foot pads. I'm not going to get into names here, but anywhere you look, you can see them. Now, see this cutout? If there's a callus in the middle, you can cut it out with your own scissors and put it around. If there's callus anywhere, you just put them accommodate. There's some for all shapes and sizes. This helps out greatly. It's very cheap. These gel pads last a long time. And also, if you have a corn on top of your toe or in between your toes, you can get gel pads for in between. After you put them on for half an hour, you don't even know they're there anymore, pretty much for the rest of your life. or sleeves that cover your toes. Again, very cheap, like $1 for these things. Prevent shearing. You have to keep the calluses down, because what happens is these calluses form hard skin on your foot, and as the callus shears away from your skin, they can tear and you can develop blisters underneath. And if you have any other medical conditions, this is very dangerous. It leads to ulcers, non-healing, and this is what causes pain in the calluses. They try and tear away from your skin as they get pushed on. And they lead to increased pressure as well. So, to prevent them, you could change your sock choice. Most people wear cotton socks, but cotton socks, the more you work in them, the more you stay on your feet, they're not very good at getting rid of moisture. So if your foot sweats, cotton socks really hold it in. In the summer, especially if you're a runner or a worker, you want to get some synthetic socks, some polyester. They're very cheap, you can get them on sale. I'm not saying go get anything expensive, just try and avoid cotton. It decreases the friction and, blister formation, callus formation, any type of skin foot irritation, especially fungus itchiness, stuff like that. And in the winter, you can get some type of synthetic wool products, whatever. They're a nice step up from cotton because they get rid of moisture a little bit better. And also, if you have a painful callus, like as you take it down, you can reduce friction by putting some Vaseline in the area, not between your toes. That's the only place I don't recommend. But what you can do is put some duct tape over the area where there's friction, and then put some petroleum jelly over top to increase the lubrication. You just do this inside your sock and see if that feels better. It'll moisten up. It could moisten it up as well if you just use the petroleum jelly. Don't put on the petroleum jelly then the duct tape. That could be dangerous. Or at least it won't stick. And if you're sweating a lot, you find you have like a little mildewy, your skin wrinkles, and then that gets irritated and forms some calluses. Go ahead and get yourself some powder. Some anti-sweat powder, antifungal powder, whatever. It's definitely going to help you. Now into the treatments. So I'm going to go over some treatments here. And not just creams, but other things. First thing you can do, a lot of people really love to use Epsom salts. So what you do is, you set up a foot bath. I'll tell you how in a second, but soak for 30 minutes until the callus gets soft. And you could do this over a period of time, and this could be the treatment itself. Or eventually it makes them soft so you could bring them down easier with methods we're going to talk about in a second. Take half a cup of Epsom salts. Now this is really just magnesium sulfate. Put it into some warm water. Make sure you don't burn yourself with hot water, and soak for 30 minutes while you're watching your favorite TV show. And then you just debride it. So use a pumice stone, an emery board. These days are called like the egg things that shave down calluses. Make sure you don't cut yourself, but as the callus is softer, it's not really hard. It shaves away very easily, and that itself decreases the friction point. You can use salicylic acid. A lot of people are big fans of this. I'm going to say this as a disclaimer, be careful. I don't really recommend you use this, but a lot of people have great results. What it does is it's supposed to kill calluses. It deadens it. It makes for easier peeling, and it makes the skin kind of fall off a little bit easier. So you could definitely try finding that at the grocery store. Consult with your pharmacist about that. This stuff's pretty cheap. But avoid it if you have frail skin, diabetes, rheumatoid arthritis, whatever. So you just apply it on your calluses. It makes them come off a little bit easier. This is an extreme case of callus, and you can just shave it off with the emery board. Put Vaseline when you go to bed at night, or aloe vera oil, cocoa butter, whatever you want to do. Soak it in before you go to bed and put some socks on so it doesn't get over your sheets. But that's going to make them softer. That's going to make less callus buildup. You don't want it to be dry, hard, and thick. You can get some higher creams, like Caramel 40 is an intense one. Urea creams. These creams are moisturizing creams that also break down the callus. These are fantastic. You could get some prescription creams from your podiatrist, but these definitely take the callus down, make it easier to shave later. And then again, just shave it down. So when do you need to go see the podiatrist? I talked before, like people with heavier weights, prior injuries, biomechanics, you definitely want to get in and have your podiatrist evaluate you walking up and down the hallway or on a treadmill or wherever, just to see. how you make foot contact. Does your heel hit first? Does your forefoot hit first? Do you have ankle instability? Things that can be corrected to prevent the callus, because taking the callus down is like putting on a band-aid on a 10-inch gash. If you're in a little bit worse health condition, diabetes, you don't have as great a balance, you have a neurological condition, you should come for regular checkups anyway, and in the meantime the podiatrist can take the calluses down, give you prescription creams anyway, the higher level ones that you want. And that's a good way to go as well. And like I mentioned earlier, the more advanced places will have hallways to walk up and down on, maybe record you, check how you're walking, where you're making pressure contact. And surgery is rare. Some people in the end, if you still can't cure your callus, it could be a bony deformity, could be a bunion, a prominent bone, hammer toes, and these things will have to be corrected if it's causing you enough pain. Alright guys, and if you want any more, come to DetroitFootPain.com. I know I threw a ton at you, but there's more guides how to do each of the things I talked about, what I recommend as far as creams and things. So come check it out, and there's a full guide there. The link's right underneath the video.
Do not try any of this at home alone without supervision. This is presented by Michigan Foot Doctors. If you think our information helped you, give us a thumbs up and come visit the site for even more.